Happening today, the U.S. Department of Health and Human Services announced it is cutting 10,000 full-time employees. That's on top of 10,000 workers who left voluntarily. The federal cuts are impacting our state health department as well. Earlier this week, the Minnesota Department of Health said $226 million in grants were slashed. Our Kirsten Mitchell is live in St. Paul with more on the impact of all of this. Kirsten.
Shayla, to put that into perspective, $226 million is about 25% of the health department's budget. They say these cuts were sudden and unexpected. Now, the health commissioner, Dr. Brooke Cunningham, says these grants were related to the COVID-19 pandemic, but impacts ongoing work and contracts. Some services that may be impacted by this include free vaccine clinics, epidemiology research, and educational outreach, just to name a few. Commissioner Cunningham says somewhere between 150 to 200 employees will also be terminated as part of these cuts. They held a town hall last night to update staff as they continue to assess the impact.
Our public servants are highly dedicated, very talented, and very mission driven. And so to do this to people and to do this to the work and to do this to Minnesotans and Americans across the country is really concerning.
Now, these cuts are also impacting the city of Minneapolis. They say 3 staff members are impacted, and they're also having to cancel upcoming free vaccine clinics as well as immunization education. Now, the state is still working to understand the scope of these cuts. Shayla.
All right, we'll have to keep a close eye on these changes. Our Kirsten Mitchell reporting.